Assalamualaikum to our respected lecturer. We are Group 2 and we will be presenting on a very important topic, Basic Life Support, Adult CPR or AED and Cardiac Emergency Management. Basic Life Support (BLS) is the immediate medical care given to someone in a life-threatening emergency before full medical help arrives. Its main purpose is to keep the person alive and buy time until professional medical treatment can take over. One of the most important parts of BLS is something we call CPR, which stands for Cardiopulmonary Resuscitation. CPR or cardiopulmonary resuscitation is a life-saving emergency procedure that is done when someone's heart stopping beating or they stop breathing. It involves two main steps: chest compression to keep blood flowing to vital organs like the brain and heart, rescue breaths to give oxygen to the lungs, although in some cases this is optional. So we go to the next slide to now doing the BLS.
The first step for adult CPR is check the scene and the person. Make sure the area are safe for you and the victim. And then tap the person and shout, "Are you okay? Are you okay?" If no response, call for help immediately.
Okay, for step 2, we need to check for breathing. Before we give CPR, we need to listen for normal breathing sounds. So, we need to check for no more than 10 seconds. After that, we need to locate the pulse by placing 2 fingers on the trachea and sliding them into the groove between the trachea and neck muscle. And the last step for check for breathing is if the person is not breathing or you cannot hear the sound of breathing or only gasping, so this time you can start CPR immediately.
Assalamualaikum warahmatullahi wabarakatuh. My name is NURFARAH binti REZEMI. So, next I will present you about step 3, start chest compressions position. To begin chest compressions, place the heel of one hand in the center of the victim's chest. Then, place your other hand on top, interlocking your fingers. Keep your arms straight and position your shoulders directly above your hands. The correct compression depth is at least 2 inches or 5 cm, but no more than 2.4 inches or 6 cm. Perform compressions at a rate of 100 to 120 per minute. Make sure to let the chest fully recoil after each compression to allow proper blood flow. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Jannah binti JASMI and metric number is D20231108-176. So I will present the next step. Step 4 is giving rescue breath. After 30 compression, give 2 rescue breath. First, lead the head back and lift the chin. And then pinch the nose shut, make a seal over their mouth with yours. Next, blow in for about 1 second, watching the chest rise. After that, give 2 breaths, then return to compression. If you are not trained giving the breath, do hand only CPR, just chest compression. That's all from me. Thank you.
Step 5. Use an AED if available. This will be explained on the next slide.
Now we will see step 6, continue CPR. Doing CPR, keep going 30 compressions and 2 breaths until first emergency responder arrives. Second, an AED tells you to stop. Next, the person shows sign of life, such as movement or breathing. And then, if you are too exhausted or to continue safely.
So next, I will talk about AED and cardiac emergency management. So, what is an AED? AED stands for Automated External Defibrillation. It's a portable device that checks the heart rhythm and can send electric shock to try to restart the heart. So, what is cardiac emergency? Cardiac emergency is a sudden, life-threatening condition involving the heart that requires immediate medical attention. Cardiac emergency happens when the heart stops beating effectively. This emergency can include heart attack, sudden cardiac arrest, and unstable angina, among others. The most serious type is a cardiac arrest, where the heart suddenly stops pumping blood. This can lead to death within minutes if not treated quickly. Prompt diagnosis and treatment are crucial for improving patient outcome and reducing the risk of death or permanent brain damage.
Next, why AED is important. If someone collapses from sudden heart problems, using an AED in the first 3 to 5 minutes can help save their life. It can increase their chance of surviving by up to 70%. That's why AED should be in public places like schools, shopping malls, and gyms. Places where many people go every day. The fastest we use the AED, the better the chance to save a life.
Next, we must know the 7 basic steps in cardiac emergency management. The first one is danger. The second one is response. The third one is shock. Next, airway, and then breathing. The second last one is start CPR, and the last one is defibrillator. It means AED.
How to use an AED. Once an AED is brought to the scene, press the power button or open the lid. The device will start giving voice instruction to guide you. Step 1. Attach the AED pads to the victim as shown in the diagram. One pad on the upper right chest and the other on the lower left side. Step 2. Make sure no one is touching the victim. Stand clear when the AED analyzes the heart rhythm or give a shock. Step 3. When prompted by the device, press the shock button. Step 4. After delivering the shock, continue CPR if instructed by the AED. Remember to stay calm and follow the AED's voice instruction throughout the process.
My name is Nurul HUSNA BINTI KAMARUDDIN. I will continue the presentation. Why time matters for use an AED. Firstly, each minute's delay in using AED 7 until 10% drop in survival chance. Number 2, if defibrillated within 1 minute, 19% survival chance. Number 3, after 10 minutes, survival is rare without help. That's all from me. Thank you.
Okay, nowadays many public places are equipped with AED to prepare for emergencies. What more amazing is that not only trained staff but also ordinary people have successfully used them to save life. The process is quick, safe, and easy to use, which means anyone can be a lifesaver.
In conclusion, cardiac emergency are unpredictable but treatable. AEDs are life-saving devices that are simple to use. Lastly, knowing how to act quickly with CPR and an AED can be the difference between life and death. Thank you.
We can't be friends.